Cerebral palsy. Cerebral palsy is a group of non-progressive motor dysfunction involving posture and movements, which may be due to damage to the developing brain. Remember that cerebral palsy may or may not be associated with mental retardation. Also note, if it's progressive motor dysfunction, then it's called as encephalopathy and not cerebral palsy. Now coming to the causes. The cause of cerebral palsy is majorly unknown, but some say it may be due to perinatal insult, etc. Now let's see the types of cerebral palsy. As you can see in this picture, based on the site affected, various types of cerebral palsy is depicted. Coming to the first type, that is pyramidal type of CP, also known as spastic cerebral palsy. Spastic cerebral palsy includes spastic hemiplegia, spastic diplegia, and spastic quadriplegia. Spastic diplegia is the single most common type. In this, mainly lower limbs are affected, but upper limbs may also be involved. In spastic diplegia, the patient has commando crawl-like manner. Now coming to spastic quadriplegia. In this, all four limbs are equally affected. It is most severe among spastic types and also associated with PVL, periventricular leukomalacia. Other types of cerebral palsy includes extrapyramidal type of cerebral palsy, so known as dyskinetic or chorioathetoid cerebral palsy, seen in babies with kernicterus and asphyxia. The third type of CP is ataxic CP. Here, the lesion involves vermis of cerebellum. The fourth type is mixed CP, fifth atonic CP, and the sixth type is unclassified CP. Now let's see the management of cerebral palsy. After evaluating the patient completely and ordering MRI scan, the treating physician must proceed with the treatment. Since CP being a non-progressive disease, the child has ample opportunities to get healed. Moreover, one has to advise the anxious parents that their child will improve and they have to be optimistic in the future. The parents must be told to look for what their child can do, rather what he can't. Physiotherapy is our first and foremost treatment for the babies. Here, a point to be considered is that the rehabilitation of the baby is the most important parameter of managing a child with CP. This approach of utilizing medicine plus physiotherapy plus counseling is better termed as holistic approach and is very important to be considered here. Coming to the medicines that can be used are oral baclofen for spastic CP, which is a centrally acting muscle relaxant, and use of Botox may also be considered in above condition. I have provided a link of video explaining more clearly about its management. Do watch it.